Let's talk about coenzyme Q10's benefits. Now, as you're probably aware, very popular supplement, but first let's get a little background. Do you even need to supplement, number one? Well, what we know, coenzyme Q10, it's naturally produced in your body. It's fat soluble. Your body generally produces enough outside of a few circumstances. I'll talk about that in a second. It usually produces enough to give you what you need, which is why it's not called a vitamin. When it is produced in your body and you have ample amounts, it acts as an antioxidant, which it gets a lot of press for that. It acts as a membrane stabilizer. And a really important function is it's a cofactor in a lot of your metabolic functions. We talk a lot about mitochondrial health here. So it's very critical for that. Now, one thing to keep in mind, I mentioned your body makes it. However, if you're not getting certain nutrients, you will run into problems being able to make enough. Some of those include, requires, first of all, like 17 steps to make coenzyme Q10. Requires vitamins, the B vitamins. Vitamin C also requires trace elements. Now, you can get some coenzyme Q10 from food, primarily in organ meats, liver, kidney, pancreas, those sorts of things, but not a lot of people eat organ meats, which leads to the next question before we start talking about the benefits. Well, if you think you need to supplement, should you get your blood levels measured? You could do that, but unfortunately, it's not super reliable, meaning you can get your blood levels of CoQ10 measured, and that may be ample. It may show that you have enough. However, you have no idea how much coenzyme Q10 is actually in your tissues or your cells. I'm not saying the test is worthless. You just have to understand it's not going to give you the complete picture in every case. Now, are there benefits to actually taking CoQ10? There are. I'm not saying these are all of them. These are the ones that I've found the best evidence for and the best feedback from people in the real world that it actually works. So the first benefit, and one of its most popular, is congestive heart failure. In studies, they gave CoQ10 from anywhere from 30 to 300 milligrams. They did that daily in 2 to 3 divided doses. You're going to see that a lot with CoQ10, not giving it all in one dose, but dividing it. Another way to get that dose is to do 2 milligrams per kilogram of your body weight. It did help in these studies. There were a study or two that showed that CoQ10 did not help in congestive heart failure. However, there's concerns around that maybe being related to the dose, the duration of the dose, and other factors that come into play that may contribute to that. However, I think there's enough evidence to support CoQ10 and congestive heart failure. The second benefit for CoQ10 would be diabetic neuropathy. Obviously, that pain and tingling diabetics can get in their extremities, particularly their feet. They use CoQ10 at a dose of 400 milligrams a day for 12 weeks on its own, and it showed that it helped. Or what they're also doing is they're doing a little bit lower dose of 100 milligrams CoQ10 3 times a day, and they add that on with the prescription drug Lyrica at 150 milligrams a day. Do that for 8 weeks. They saw improvement in both those cases. So if you're on Lyrica and you don't want to add on another prescription med, CoQ10 may be something to look at. Third benefit I want to talk about is fibromyalgia. Also 300 to 400 milligrams a day, divided doses. They did it from anywhere from 40 to 90 days. Did see a decrease in those fibromyalgia symptoms. The fourth benefit is low oxygen from cardiac surgery. So when they go in to do a cardiac bypass, there can be damage from the lack of oxygen during that procedure. So they've given anywhere from 150 to 300 milligrams a day, 2 to 3 divided doses once again. And they're doing this about a week or two before the actual cardiac bypass surgery happens. So obviously make sure to talk to your surgeon, your doctor about that, but it is something to consider. This one I like. The fifth benefit is migraines, because so many people have them. This may be important to look at. 100 to 150 milligrams a day of CoQ10. In one study, it lowered the frequency of migraines up to 50%. They did that for a while. One thing they did find is that it takes some time for these folks to experience benefit from CoQ10, up to 3 months before they really started noticing the differences. So you have to be patient. There were other studies that showed benefit, but they weren't as extreme as this. It was beneficial, just not decreasing it by 50%. Okay, but something to look at. Sixth benefit would be multiple sclerosis, so MS, fatigue, and depression. The fatigue is a huge thing in MS patients. So they give them a fairly high dose. This was one that was just done daily, 500 milligrams a day for 3 months. Again, did show some improvement in the fatigue as well as the depression. Seventh benefit, muscular dystrophy. Interesting one here. Lower dose at 100 milligrams a day for 3 months, and they did find it tended to improve the physical performance in those folks. Okay. Myocardial infarction, kind of a fancy way of saying a heart attack. Gave them 60 milligrams twice a day, and they started doing that within 72 hours of the actual heart attack. And what they found is it showed a lower risk of future cardiac events. And those future cardiac events were considered a wide range of events. I won't go into the details on that, but considering it showed some benefit, that may be something to consider. And finally, Peyronie's disease, kind of rare, but it can actually be scar tissue, a fibrous sort of scar tissue that builds up in a man's penis. It can be the result of an injury, different things. And what happens is that builds up, and there can be curvature of the penis, trouble with erections, those sorts of things. They actually gave CoQ10 to these guys, 300 milligrams a day for 24 weeks. The thing is, it has to be in very early stages of this disease. You can't give it late stage, but they did it in early Peyronie's disease. It decreased plaque formation and size. Erection function was improved, and disease progression slowed in up to 76% of patients. So as you can see, the reason I wanted to bring up the metabolic cofactor, a lot of these benefits that we're seeing, I believe, are related to CoQ10 helping with that metabolic function. So it's very critical. And obviously, we touched on, you've got to have a good base nutrition in place to be able to make enough CoQ10. So does it make sense to supplement? It depends on your situation, depends on what you're looking to have happen. But yes, I do think CoQ10 can benefit a lot of folks, but make sure obviously the nutrition thing is dialed in first, and then maybe think about supplementing. So I hope this was helpful, you guys. Please like and subscribe if this was helpful. It helps the videos get out to more people. Also comment. Let me know if you've taken CoQ10, if it was helpful. Finally, get your free checklist at curtis-alexander.com. It'll give you other options outside of drugs and surgery. See you in the next one, guys. Thank you.